Hi everyone, welcome to the Fat Doctor podcast. I'm thinking it's episode 21. I'm not sure. I'm not sure that I care either. It's something like that. It's already a good start, isn't it, Ross? I'm very excited to welcome back a good friend of mine, someone whom I absolutely adore and who has been cracking me up on Instagram lately. We're going to have to talk about those videos because they're hilarious. But welcome back to the show, Ross Anderson-Doherty. Which I can't say it. I don't know why. It just really frustrates me. Go on, say it properly.
The Doherty bit.
Yeah, but say it with the accent, because it's not
Ross
meant to be.
Anderson-Doherty.
Yeah, it's meant to be said like that, you see.
Doherty.
That's the problem,
Doherty's a tricky one for non-Irish people to say.
right? Because it's that kind of. I'm not even sure I can do the. It's that the H.
If
It's
you're
the
from
H
sort of
R.
west of the Ban in the north of Ireland, it just becomes Doherty too.
Does it? Just miss it all
Like
out.
where my partner's from, he would get called Dorts. Yes, Dorts. What's a crack?
Oh dear. Right. Well. Okay. Good. We already fumbled the pronunciation. I just get really wound up about these things. But anyway,
You
thank you
didn't
so much
fumble it. You
for
said it
joining us.
perfectly.
Now you're just being gracious. So I've known Ross for several years. I think I found you on Instagram and was just like, who is this
Yeah.
person? I must befriend this person. Um, and you are a performer and I should get this right. Creative director, is that the correct
Creative
title?
director, artistic director. Yep. Of a
Mm.
cabaret club. It's a cabaret supper club in Belfast.
And it's amazing. I just every time I look at the website, I'm like, oh my gosh, this looks like so much fun. I've got to get. I've got no excuse not to get over to Belfast now. We're so close. So that's part of what you do. We're gonna be talking a little bit about being fat and trans non-binary and all sorts of other deliciousness. But I'm not going to do that thing where I make you introduce yourself because that's just cringy. But maybe you want
Like
to
an
offer.
icebreaker.
And yes, maybe offer well, I can't think of another word that isn't introduction now, but kind of just warm up the audience, Ross, because you're really good at doing that. So can you warm up the audience for us?
We'll just own it and I'll do a wee brief introduction of myself.
Okay,
So hi
let's do that.
guys. I actually started talking again. I am I'm Ross. I am a non-binary person. I am for those who can't see me, if you're listening to this and not watching it on YouTube, I have a big non-binary beard and a bold pink lip and a stripy shirt dress that's multicolored. Um, and I'm 43. I've worked in the arts my whole life. Um, and at the minute, my main focus is being the director of a cabaret club where I work with like an incredible amount of talented people who are, you know, from lots of different backgrounds, lots of different um, shapes, sizes, disabilities, all kinds of things. We are a motley crew, um, and it's a very, very cool thing. So that's what I spent most of my life doing. I also teach and I write and I do, I'm a freelancer in the arts, so clearly I have 700 jobs at any one time.
Mm.
And I'm fat. That's the thing. I
Um,
came out
I,
as fat in 2018.
um, and we're grateful for it. Thank you for coming out as
Thank
fat.
you.
We'll do that.
Thank you.
So it's you do have a bold lip. And you love a bold lip, and we were talking about your bold lip. I particularly like this color actually, and it's probably not a color I would have said I like, but on you, it's gorgeous. So if you're
Thank
not
you.
watching on YouTube right now, you probably need to head over to YouTube just to check out Ross's lip, and enjoy it for a moment. Um, so we've been talking for a while now on this
Mhm.
series of the podcast about medical trauma, the challenges that we're experiencing in healthcare, and kind of labeling it as trauma, like using the term trauma, which um, kind of has lots of connotations nowadays, and sometimes perhaps is used when it shouldn't be used. But I think when it comes to medical trauma, it's not used enough. Like we don't
Mm.
talk about these experiences as trauma when that's clearly what they are.
Mm.
So I'm wondering, as somebody who has more than one marginalized identity, what your experience with the healthcare system has been like so far. It would be really bad if you turned around and said it's been amazing. So,
Been perfect. I have had absolutely no problems, no complaints, just plain sailing. No, it has been um my interactions with the healthcare system in the north of Ireland have been singularly one of the most devastating processes that I've ever engaged in my life, particularly since around 2020, 2019. Um, they started to coincide, or they started this, the beginning of it coincided when I came out as fat. I know I say that reasonably glibly, but for me, coming out as fat means being open about the fact that you're not on a diet.
mhm,
Obviously people can see you're fat, but
mhm,
saying I am fat and not I am trying to be smaller is a
mhm,
form of coming out for me. And uh, doing that to the world in general, it's pretty tricky. Um, for all of the reasons that you have been discussing for very many years, and I'm very grateful for them. Um, doing it to doctors, um, who are middle to upper middle class assholes, um, in what is a reasonably posh part of Belfast, when I'm not a particularly posh person, but for whom fatness is anathema in every single possible way, was horrifying.
mm,
Add to that a layer of my gender presentation, as it were, becoming more and more authentic for me. There's a whole question about where authenticity is made and perceived and all that, but for me, it feels more authentic to present my gender like this in a more femme way. Um, and the response to that from the medical profession in general in this part of the world has been cold. It has been callous. It has been dismissive. It has been cruel, and it has been unethical. There's no other way of putting that. Um,
I want to explore all of those things, but you said something that has like hit me sort of in the face. And I'm like, I never thought about it this way, but my God, that is so true. The idea of coming out as fat,
mm,
and then also that you and I have some experience of coming out. Right? I came
yeah.
out as queer in 1994. I came out as bisexual a few years later, which was terrible. I felt like I was going back in rather than coming out. I came out as trans in 2021. But you're so right. Like those experiences are very similar to coming out as fat. As somebody who is experienced in coming out, I wonder if you could maybe expand on that because I think there might be some people listening going, "Oh my God, that's what that is." Yeah,
Mm.
the coming out
For me,
process.
I mean, for me, in my usual style, my coming out process involved writing, producing, performing, and touring a play
Mhm.
called Cake Daddy,
It was
which
amazing.
it was great fun, and I absolutely adored it. And the whole production of that play was my sort of getting to grips with diet culture and the lack of science behind diet culture, because that was the thing that was holding me back from
Mm,
accepting my fatness. You know what I mean? That was the sort of the thing that held me back from going, oh, I just need to be fat then. Okay, cool.
mm,
Because it goes against every single bit of radical politic that I have in my body to
mm,
try to be smaller. You know what I mean? If I'm queer, anti-capitalist, anti-white supremacist, then I can't be running around on a diet. That's
right.
that's not for me. Um, so the process of that, because I was doing it quite publicly, and because I already sort of in Belfast, I know we had this persona of being sort of, someone who dressed colorfully, a bit like a children's toy, and sang well and said, and, was witty and said funny things and acted in some stuff. And, so some people knew me, like very, like not a great many, but some people knew me. Um, and so a lot of the sort of the body positive stuff at the time was sort of around, and people jumped on that. And are like, yeah, everybody should love their body. And there was me, all brightly colored, going, yeah, everyone should love their body, but that's not what body positivity means. Body positivity means equality for marginalized bodies, is what it means. Liberation from marginalized bodies, not, you know, some size 6 white girl on Instagram who folds her stomach and has a little roll and goes, I still love myself. That's not body positivity. That's white supremacy. Shut up. Um, so that jarred with an awful lot of people. In my personal life, I just sort of brought everybody along with me on the all my friends and family. Everybody was sort of fat liberation workshop as they went along. Do you know what I mean?
Yeah,
I had a
I'd
lit
relate.
review that people could read. They didn't have to. It was either read that or listen to me for quite some time. Some people chose to do the reading. That was fine. Um, and with that, I mean, that's still a sort of ongoing process. Obviously, being a fat person in the world is still it's still, you have to deal with the shame that and the guilt that they try to heap upon you. That's a constant sort of like, whoo, shields up, wah, sort of vibe. But the process of that was greatly accelerated because I was doing it publicly. Great, fine. Personally, though, coming out to a doctor and saying I'm not interested in weight loss as a my mind's just gone blank on the word, a treatment
Mhm.
plan, was like one of the most difficult things I've ever done in my life.
Hands down.
And the response to it has been, I'm going to say, catastrophic for my
Yeah.
health. It's taken me about 4 or 5 years to get to where I am now, which is where I could even talk about it and be healthy, whatever that means. I mean, also, can we talk about the word healthy? I know you talk about the word healthy and you're excellent on the word healthy. Like, if we can't acknowledge as a group that like health is a fucking white supremacist capitalist patriarchal ideal to which we're all frigging held, and not something that is of any actual benefit to us. If we
Yeah.
can't acknowledge that, we can't
Yeah.
move forward. And I find it frustrating.
Yes.
Um,
Very
because
true.
it closes down our language, then it means, you know what I mean? It means for me to talk about my health now, we still see health as one stable, unified singularity that is achievable rather than an ongoing process and something that we, have to try and do. Anyway, I'm at a point now where my body is functioning in a way where I don't feel like crap all the time, and I don't want to curl up in a ball under a blanket all the time. Um, and it's only now looking back that I've even started to process any of the sort of medical interactions um
Mm.
in and around that.
Yeah, I think I've had quite in terms of coming out, I haven't had the easiest experience. I've lost friends. I don't know that I had particularly supportive family. Shout out to my sister who's been amazing, but not everybody's been massively supportive. And obviously, my husband, the kids have been great. But my God, was that easier than coming out as fat? I mean, and even with doctors, I agree with you. It's much easier for me to tell them I'm transgender, which hasn't been easy, but much easier to do than to come out as fat and say I'm not trying to lose weight, and actually to stop them from assaulting me
Hmm.
continuously with their weight loss advice, because it is an assault. I've said
Hmm.
no, and you keep doing it. I've said
Yeah.
no multiple times. How many more times are you going to keep doing it? That's assault.
Mhm.
Um, what what have your experiences been like? I mean, you don't have to share all of the really painful things, but are you able to
I
share
don't
it?
mind sharing the really painful things, actually,
Okay,
because um they have less hold over me now, which is good.
good.
um so I think the first thing was just general sort of ongoing health things like asthma and whatever, just general sort of stuff. Um, and it was sort of just a general like, oh, I mean, everything's okay, but you should probably lose some weight. And I said no, thank you. Um, and it was like I had like dropped a try and taken a shit on their desk right in front of them. The reaction to me going, no, thank you, I'm not interested in
Mm.
that. Thanks. Um, there was ice creeping up the walls. The the conversation basically came to an end very quickly, and all of the other concerns that I had that I was going to talk to the doctor about were dismissed pretty
Mm.
much immediately, and I was ushered out. It's as simple as that. It sounds like something from, you know, some earnest student film, but that's what happened. Um, as time went on, I got COVID about 500 times because my job is to breathe in front of people. Singing, I think it's called. And my body reacted pretty poorly to getting COVID, as so many bodies did.
Mm.
Um, and so there's sort of two strands to this. One is that they still ignore the symptoms of long COVID and haven't and refuse to refer me for, or even mitigate the symptoms. Do you know what I mean? Like
Mhm.
do not care for symptom relief even slightly.
Yeah.
The other thing, and that has had a massive impact on my life. But every time I go in, the fact that I am a fat person means that they won't treat it because I haven't gone out of my way to lose weight. Tale as
Yeah.
old as time. And the other thing was that I was diagnosed with diabetes in 2021, which is something my biological dad had, um, and something that having COVID a few times probably sped up happening,
Part of a very special club. I just want you to know that we are amazing, all of
aren't
us.
we?
All of us
Aren't
are
we?
awesome. Yes, carry on. Very
We are.
difficult to manage
We
this
are.
post-COVID diabetes. I just want to point that out. Really, really atypical presentation of type 2 diabetes, but we'll get to that another day, I think.
Well, I mean, that's been my experience of it actually, that
Mhm.
you know, that metformin and not eating
Yeah.
weren't working for me.
Yeah.
My blood sugars were still
Yeah.
sky high,
Yeah.
and they were like, well, um, but it's again essentially just not treating me. And this went on for, I'm going to say, a good couple of years.
Yeah.
Um, they then refused to treat my ADHD. That's a
Mm.
systemic sort of problem from another place, but also included in that was my hypertension,
Yeah.
which again, they were trying to treat through weight loss. And I was saying, I'm not interested in that. Can you treat the hypertension? And they weren't.
Mhm.
And it took an intervention from a psychiatrist to get them to actually treat the hypertension
Right.
and to get them to refer me even to a cardiologist to approve all of this because they're so risk adverse that they wouldn't. The cardiologist looked at me and was like, yeah, well, now that you have the right blood pressure meds, your blood pressure's fine. You're doing everything you can. I can see that. Good for you. Off you go. And I wept in front of this man. Wept. This is a theme. There'll be a theme of me weeping and water dripping from my beard. Because I weep so hard. Because just the someone being nice to me in a medical setting was
Mm.
so upsetting that I sobbed to this cardiologist who literally just went, oh no, yeah, you're managing your blood pressure fine. Good for you. Well done.
Mm.
After they did a 24-hour cuff and all that and stuck things to me and made me do things. They're like, yeah, you're grand. Anyway, so the fatness again was used in to not treat my neurodivergence.
Yeah.
My God, the more I think of it, the more layers of complexity there are to this of how much
Yeah.
they're choosing to ignore through my fatness.
Mhm.
So the interactions, I had to cut them off essentially. I just couldn't function. So I just had no, I couldn't even order a repeat prescription from them. So I was just buying the prescription drugs that I sort of needed a little bit, maybe from online pharmacies, and losing my mind and losing whatever physical health that I had. My blood sugars were just clearly creeping up and up and up. My blood pressure was going up. Um, I was losing. I didn't have any ADHD meds. I had still had the sort of inflammatory symptoms of long COVID.
Yeah.
Um, I feel a wee bit like, that mate of your granny who just sits down and tells you everything that's ever been wrong with her. That's how I feel right now. Just her French and Saunders character going, well, I actually had my heart removed on Monday. Yes. But
So we're
I'm just sort of, as I'm saying this, I'm sort of reckoning with it myself, going, oh, wow. Because from a place I am now, I, one forgets, one has
Mhm.
to forget in order to function.
Yeah.
But so I had all of this sort of collapsing down on myself and no support from the doctors because I literally could not go to my doctor without having, I couldn't even think about going to my GP without having basically what was a full-on panic attack. And I'd never had a panic attack in my life before.
Mm.
Um, I didn't know what one was. Thankfully, I have some very good friends and an excellent partner. Um, and my saving grace in all this was I met a private GP who was kind enough to really help me out. I think maybe just because she enjoyed my crack a little bit. I'm not sure. She's a she's a singer and performer too. So do you know what I mean?
Oh, that.
She was like, oh, you're a good crack. And she was a bit like, oh, you're a good crack. Oh, you're falling apart. Oh shit, let's help. But one of the things that made me feel safe with her was the fact that when she met me, she complimented the dress I was wearing straight off.
Mm.
She complimented my pretty Vivienne Westwood glasses. Like those glasses are really cool. I wouldn't be cool enough to wear those glasses. Whereas my interactions with my own GP or GPs, because they passed me from pillar to post because they were all terrified of me, were of nothing but awkwardness and sometimes actual frustration at my refusal to be a good gay man. When I was performing the role of good gay man for them previously, good gay man who wanted to be thin, but the good gay man is not insignificant in this equation. They could cope. That was okay.
Mm.
I don't know what would happen if I went in and told them, "Hi, I think I'm a trans woman or I want to transition medically in some way." I don't know what would happen. I don't want to do that because but I'm not dysphoric about my body. I'm dysphoric about what adorns my body and how I, you know, how I how I put it out into the world, but not it itself. I don't know. Um, but I know that when I stopped playing the role of the good gay man, they there was one guy in there, the type with tapered chinos and pointy shoes. He the ones I'm talking about.
Mm.
Mustard and chinos with
Mm.
a pointy black shoe,
Mm-hmm. Mm.
getting all up my grill, getting frustrated because he was going to examine my stomach. I'm still not entirely sure why, but he was going to examine my stomach, and I was wearing a dress, and he refused to say the word dress. He was like, lift your thing, lift that t-shirt, and like got to that point, like shouted like that at me,
Wow.
which I assume part of it was he didn't want to perhaps offend me and call it a dress because he thinks that's offensive in his world, which is
Mm.
offensive in and of itself, obviously. And then he
Yeah.
just got frustrated. And then do you know what I mean? But the overall effect was he was shouting aggressively at a patient about their clothing.
Oh
which
my.
wasn't ideal.
Mm,
So anyway,
mm.
do you still want me to keep talking and telling the story of how I got to where I am now, or will
Yeah,
we?
I've written notes.
Okay, cool.
There's so much
There's so much. There's
there's so
ridiculous.
much to explore, but you just
It's
keep telling the
ridiculous.
story for now.
Okay, so
You
I
go.
met the lovely doctor who's an absolute legend of a woman, um, who helped me out and heard me, listened to me, apologized for her profession,
Oh.
um, heard me cry a lot after
Hmm.
she was nice. And we basically came up with a plan together, which was to get my numbers. Just let's just focus on that. She was like, my job is to help you get the numbers down. That's what I can help you with here. So she gave me some prescriptions and helped me bring my numbers down, my HbA1c. She was like, let's get that down without you losing weight. Let's make sure your blood pressure is controlled. Let's make sure all the things that you need, you have. And then when you're feeling better and in a stronger place, you go back to your GP and you get them to do the blood tests, but you'll already know what the blood tests are going to say. And you
Hmm.
go in and you get them done and you can tell them that you have achieved all of these numbers without losing a single kilogram of weight.
Nice.
And that's what I did. And
Hmm.
I honestly could not be happier about it.
You- You're gonna have to paint that picture for us in a moment, but we need to get there first.
Yeah, I know. I know. We have a lot of work to do.
We have so
Roll our
much to
sleeves up
unpack.
here, Asher. Let's
Yeah,
go. My God.
it's time to start at the beginning because I want to get to the end part when I need to hear you reenact what happened with the GP when you finally got to sort of be like, fuck you. My numbers are down and I haven't lost a kilogram of weight, but
Oh, it's
we can't
one of
get to
those.
we can't, it's like reading the end of the bit before we
Yeah, yeah. We need to. Let's go back. Let's go back.
let's go back and then and then we'll get there.
Yeah, yeah.
So I heard a lot of different ways in which weight stigma reared its very ugly head. But just in, I know a lot of my listeners are in similar boats. I know a lot of my listeners are diabetic. I know a lot of my listeners have long COVID and are being ignored. And I think everybody with long COVID is being ignored, to be fair.
Yeah.
But I think that of all the people that are being taken seriously, so it's not everybody. I would say the majority of people with long COVID are being ignored, but the ones who are being taken seriously are the thin ones, the professional ones, the
Hmm.
ones who are respected and upstanding members of the community.
Yeah.
Because look at that doctor who used to do
Yes.
like
Oh
four
my
days.
God. This
Yeah.
person who's a lawyer and who runs marathons
Oh,
now
oh,
can't make it to their mailbox.
right.
Yes. Yes.
Right. Whereas everybody else is just like lose some weight, stop being so lazy, eat better, exercise more, that kind of thing. That is, these all of the symptoms dismissed. Um, and the diabetes and the blood pressure, classic, even though
Hmm.
there literally is no evidence. In fact, there is evidence. It's not there isn't evidence. There is evidence the weight loss doesn't work. Like weight loss doesn't drop your blood pressure, and weight loss doesn't drop your HbA1c. Like conclusive evidence. We're still gatekeeping treatment, even not even giving people the right treatment because
Hmm.
you've come out as fat. You don't get this. You don't get to have any of this. Then the ADHD. Again, a lot of my listeners have ADHD, surprisingly enough, and are being denied medication, surprisingly enough, for the very same reasons. Oh, but you're a walking heart attack waiting to happen. We can't give you these medications. And we know that it's really hard to get ADHD medications on the NHS now for most people, and still there are layers of kind of who might get access. There's a ladder, there's a hierarchy. You at the top might get access to these medications, but you down here at the bottom, absolutely not a chance. So I hear all of the stigma, which is shit in of itself,
Mm.
but the way you were treated, like there is that they're not being able to access the treatment which you deserve, and that's not okay. But the way you were treated, um, the way you were so suddenly dismissed the moment you came out as fat, and just literally ushered out the door, and the way that someone being nice to you literally caused you to erupt into floods of tears.
Mhm.
I'm, yeah. I wonder, like, what has it been like as you're talking about this now and telling it in a sort of very factual way? What's it been like holding on to this trauma, all of these emotions? What's that like?
I can't pretend it's been anything other than hell at
Mm,
times for the last few years. It's only since finding that other GP, the private one,
mm,
um, who's awesome and generous and kind. Um, Only since meeting her and having a strategy, having a plan, and having um, I shouldn't I shouldn't have to have my numbers in the right place in order to be taken seriously in a doctor's in a GP practice. That shouldn't be the case, but it had to be to even overcome all of those things so that I could even get a repeat prescription for lisinopril.
sure.
And it has been honestly hellish. And my friends and family have put up with a lot of me disappearing from life, from public life, from private life, from all spheres of life. And it is literally only the last couple of months that I have started to come back out again. Um, and dare I say it, enjoy things.
Mm,
That sounds so dramatic. But, I was aware yesterday I spent time with my friend and we had a lovely, we had a little coffee and, both needed some cleanser. So we went and bought some cleanser. I treated myself to, a little avocado and egg breakfast like I was middle class. And, got back to the house to do a little bit of paperwork. And I was sitting and I went, oh, I feel happy. And that feeling had been so foreign
mm,
for so long.
mm.
Um, and so much of that was caused by my trauma response to that medical neglect, is what I'm going to call it.
Yeah. And I'm so happy to hear that you had your avocado and eggs
Thank
and
you. It was
got your
delicious.
cleanser and you had fun and you were happy. And I know that that is a real
Yeah.
foreign thinking. And I, you know, it's been a difficult couple of years from you. I could see that you were struggling a lot, and um, I'm fortunate enough to have been been able to spend some time with you um in the past. So know you well enough to know that you were really going through it and you were being treated with like garbage for a really long time by our medical professionals. And I hear that things are better now, but it
Mm.
took a GP to help to do what she did
Yeah.
to get you there. You know, if that hadn't happened, I wonder, do you think you would still be in the place that you are today?
No, absolutely not. And I'm very lucky that I happened to meet someone who was willing to help me um, outside of NHS structures,
Yeah.
um, and then let me get to a point where I could pay for some private prescriptions from her, you know, like a GLP-1 for the diabetes, for example,
Mm.
um, but not for weight loss,
Mm.
um, because that's achievable, and I like being a big fat fact of that. um, that they were designed to treat fucking type 2 diabetes, which, you
Yeah.
know, has been historically really difficult to manage, despite what people would tell you. Anyway, um, had I not been sheerly lucky enough to find that and then been privileged enough, like I don't have any generational wealth or I don't even have a fucking pension, for goodness sake, I work in the arts. I, but I like gather together enough resources that I could pay for those in order to in order to sort of scramble back some health enough for a few months. And if I hadn't been in that privileged position, I would be under a blanket somewhere with an A1C of 200 and, you know, blood pressure of 180 over 140. Do you know what I mean? Is
Mhm.
where I would be with my kidneys hanging out my arse and my brain lying beside them, you know,
Mhm.
is where I would be had it not been for that intervention and the sort of privilege, you know, the amount of privilege that I hold in the world. um, I would be a mess, a mess.
And I want to preface this by saying she sounds amazing. All hail to this
Yeah,
GP. Great
she is.
woman, fantastic, very hard to come by, and I think she's wonderful. And I also want to say that she didn't do anything remarkable in of itself. You know, having heard the
No,
story of her, you know, she it is remarkable because compared to the rest of the healthcare system,
yes,
the rest of the doctors,
she says this herself. To be
yeah,
fair to her, yep,
I'm
absolutely,
sure she does because good
she
GPs probably
does.
do. Just doing my
She's
job.
literally like, I'm literally just doing my job, Ross.
Yeah,
Like
that's
it's,
it.
no,
That's what
I'm
I
not.
do.
This is what. Yeah,
Not,
this is.
yeah,
Yeah.
not surprised that she's not working in the NHS anymore. That does not surprise me at all because I imagine it wouldn't be possible for her to be able to do her job the way she wants to do it within the NHS.
Yes.
But things
She.
like
Yes.
complimenting your dress and your glasses, these are basic skills that we were taught right at the beginning when we were talking about communication skills. Build rapport with your patients, the first thing we're taught how to do, and complimenting a person's clothing is a really good way to do that. So she's obviously really good at her job, but I don't think that that's remarkable. What is remarkable to me is another doctor feeling uncomfortable talking about your clothing. That's the part I find quite remarkable, and remarkable
Mhm.
in a negative way, of course. I'm really shocked by that story you told about lifting up your whatever that is. I am genuinely shocked. It also made me realize, huh, I don't get treated like that. Now, to be fair, I do have a bunch of good GPs who have been quite supportive. My particular, I live in Scotland, I think that's probably part of it, but they've been good. And they've been really, really supportive when it came to my gender identity. I've never had any issues, but I wonder if I was you know, trans femme, if I was wearing a dress, whether it would be
Mm,
different. I wonder, you know, because there is that misogyny, there is that extra layer again of like you are wearing a dress, and that
mm,
is problematic. If you were a cis woman, we could handle that because cis women are supposed to be wearing a dress, but whereas Ash is wearing a t-shirt and trousers and suspenders, and that's okay. They don't have a problem saying remove your suspenders. You know, it's a different, it is a different experience, I think.
yes. Um, I've transgressed masculinity, and
Mm.
that's, you know, and the yeah, the punishments for that and the policing of that is quite stringent. Um,
What what is a good gay man? I mean, when you talked about being a good gay man, what do doctors want from their good gay men? That came out wrong.
no, no, it came out perfectly. Um, so to be cis for a
Mm,
start,
yeah,
um, to dress in trousers and a shirt and, you know, little
yeah.
jackets or whatever, um, to be camp enough that you're entertaining.
Mm,
This is also a thing I find with doctors and professionals in general. Whenever they find out I'm a performer, they start to talk to me like I'm a toddler for some reason, very
mm.
often, not all of the time, obviously. Um, but that becomes like, oh, you up on your stage doing your, you know, it becomes very that. Oh, you're doing your shows at the minute. It like that is like I've just become a cherished family pet.
Oh,
Um, that those two things sort of fed together with me and becoming, you know, the sort of like um the handbag is how I think of it.
mm.
You know, the sort of the gay best friend in Sex and the City, or the,
Yeah.
you know, that version. It's quite witty and, you know, maybe a little bit self-effacing and and will compliment their fucking hideous Zara coat or something, and um, but ultimately not subservient. That's not the word, but it's the only one popping into my head. But you know what I mean. Ultimately,
Mm,
buying in to the narratives and not
yeah.
not asking anything more of them. You know.
S- Sort of, you know, I'm gay, I'm a gay man, I'm a performer, and therefore I recognize that you are superior to me in every way, but you've somehow allowed me sort of entrance into your little world, but I should be eternally grateful. A-
Yes.
and should behave exactly as you expect me to, otherwise well, I'm out instantly. That kind of
Yes.
yeah, and doctors are fucking classist as fuck. We don't talk
Hmm?
about that enough, maybe. I mean, I talk about a lot of things, and doctors are racist and doctors are transphobic, but we don't talk
Hmm.
about how fucking classist doctors are.
Hideously so.
Oh, it's quite vile, and I actually think that there's a level of respect given to other professionals,
Hmm.
and anyone who is not a professional is kind of dumped into other categories. And I guess performer, I wonder what that category is, but it's clearly very much beneath them.
Yes, it is. That's how it's perceived. And um, when I was doing my good gay man act,
Mm,
uh, what was brought up was my teaching in Queen's, which is the university, one of the universities in Belfast, but it's the university that's across from my practice. Um, it's literally in that area,
yeah,
um, which is an area that has a large immigrant population, um, but an immigrant population that's going to Queen's mostly, and an aging population from people who live in six-bedroomed houses in
right.
what is, a leafy suburb, not even suburb, it's just outside of Belfast city centre.
Right.
Very, very affluent place.
Mhm.
And uh, I I don't work in Queens at the minute, but I do sort of go back and forth. But while I was being a good gay man, they were like, "Oh, how are things across the road? How's it go?" You know what I mean? And
Mhm.
then as soon as I started to present in more femme ways and not, and sort of came out as genderqueer, non-binary, whatever, um, then the focus became more on the performer.
Right. I'll bet.
Yeah,
I fucking
yeah.
hate that.
And these are
Obsessed.
probably things that these people do not realize that they are
Yeah.
doing. Um,
I can say with absolute confidence that they are clueless about the fact
yeah.
that they are racist and homophobic and classist and transphobic. Like
Yeah. I think
they,
I think they'd probably be horrified at the thought that they were. They would
mm,
become defended rather than actually explore the possibility that they were.
absolutely. And as I said, the ones who are really doing the work, but I just can't work with the other ones. I mean,
Yeah.
your GP, who is a private GP, is a perfect example of that. There was a long time when I was considering going into private practice because I was like, well, at least so I don't have to deal with these assholes anymore on a daily basis
Yeah.
because they're really unpleasant to be around, really unpleasant and really prejudiced. Um, but going back to the trauma, you have all of these very traumatic experiences. You're holding those in your body. Your body is literally like closing in on itself, like you are kind of retreating, going into bed, hibernating, like sort of isolating yourself from the world because of this trauma.
Hmm.
And then I recognize that, of course, now there's this lovely story of how your levels are down, and like you can finally you're in a place where you can even walk back into that GP surgery and ask for the blood tests or the drugs or whatever. Even though I know we haven't got to that part yet, but it's still not a perfect ending to the story. It's not a fairy tale ending, but at least it's something.
No.
But I wondered if you got a chance to process that trauma.
I think I'm still working out how I process trauma. as a neurodivergent person.
Yeah.
I think I need to do a lit review. I think I need to then write a paper or a play or make some sort of little show about it or do something to actually process it.
Yeah.
All the other sort of major sort of life upheavals that I've had. So I have an idea for a play in my head that I think came from that sort of thing. I won't give any of it away yet, but it's been in my head and I think I need to write it at some point. But I think to sort of get it out of my body, as it were, or to
Mhm.
sort of finish the action, as they say,
Yeah.
um, I need a creative outlet for it. At the minute, I think I'm just in the process of accepting the fact that it is in fact a legitimate trauma and something that my response to was not me just being a drama queen, you know, um, and me just being wholly insufficient and deserving of that treatment, which
Hmm.
um I'm still in that phase
Yeah.
of it. Um, moving my body, singing, putting on a bolt lip of a day. They all seem like very small things, but they are things that, you know, actively help with
Mm.
that. Um, Social media recently has helped with that, weirdly, which is a sentence I never, ever, ever thought I would say in my life. Um, but it has. Even the process of making and enjoying food has become, I'm enjoying the ritual in it now.
Mm.
Um, I, with my particular neuro flavor, I enjoy gamifying things. So my my goal with food is to what can I include in this? You
Mm.
know, that gives me more fiber. Um, I always like fiber. I always liked vegetables. I always like things like that. But what can I add to this to make it more fiber? What beans can I add to this to this particular meal? What legumes can I include in this? And that I've been doing that for months, and it's a joy to do that, you know, to eat whatever the fuck I want and include some beans and stuff in that and things that I enjoy. You know what I mean? What way can
Mm.
I fuck some chia seeds into a salad that's going to be fun? You know, all of those things are part of me processing this. Does that make sense?
Yeah, yeah. I think I think processing it to begin with, especially in the body, it is really helpful.
Mm,
You know, I think talking about it is not necessarily the solution. And you know, there's so many different ways of processing trauma, but I love the fact that actually there are, you know, oh, dare I say self-care rituals. God, that makes me feel like I want to vomit when I say it. But yeah, putting on a bold lip and making your hilarious TikTok videos and adding chia seeds to your salads and like all of that sounds like very nourishing. Yeah,
yeah.
no.
Yes.
But going back to what you said about, hey, I'm still in that processing place, and I think a lot of people are. And I think, you know, I think we're better at talking about certain types of trauma now. And I still think we're evolving. And we
Mm,
certainly weren't talking about trauma when I was younger. I mean, this is a relatively new thing. Um, but you know, we can talk about I think we struggle to talk about sexual trauma, but we are at least talking about it. I think we can talk about childhood trauma. You know, I think we can talk about domestic violence. Uh, in that we can talk about it. I'm not saying we can fix it, but we can at least
yeah,
talk
yeah,
about it. And people have a
yeah.
general understanding that, yes, that is wrong. And
Hmm.
anybody who experiences that is, you know, again, horrible word, victim of trauma. But with medical trauma, because it has become so sort of normalized, and because doctors are getting away with it, and because there is, you know, well, for lots of reasons, I'm sure, it's almost like that's a sort of a silent one that we don't talk about or that we can't
Hmm.
name, and that like then it's,
Yeah,
you know, the shame of, well, you know, maybe I deserved it, or maybe I'm being a drama queen, as you said, and all of that stuff. So
yeah,
even just naming it and saying
yeah,
this happened to me can in of itself be really difficult, and some people never
yeah.
get there, right?
Absolutely. because the medical profession has so much legitimacy in the world. It is an
Yeah.
institution that is trusted
Mm.
because we necessarily have to trust it.
Hmm.
We have no other what's the option? We just get sick and die.
Hmm.
Um, it's an institution, it's an industry, and but it hides the fact that it's an industry. Still,
Hmm.
even the NHS,
Yeah.
within all that, it still has the same, not the same, they're not presented the same, but the same machinations of patriarchy and white supremacy that the medical industry everywhere does. And that's not to say that there aren't a great many incredible doctors, and I'm very grateful for so much good medical science. You know,
Mm.
um, like somebody discovered salbutamol so I could breathe at the age of, you know what I mean? Great, delighted by that. Thank you. Um, the way it's wielded is
Mm.
entirely unethical, and
I, yeah, and statistically speaking, what are the numbers of statistically what percentage of doctors have done some really amazing things and 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 pushed down the envelope and broken barriers and done all these things and invented drugs and sure just a very small percentage of the entire
yeah.
medical institution, the entire medical industrial complex, the vast majority of whom are assholes. So I think it's obviously not all doctors, just
Yeah,
like it's not all men. We are well aware that there are some gems
yeah,
out there, but we also know that statistically speaking, they're not that many. They are not the majority, that's for sure. And the majority of doctors, and I mean, I wish I had a number for it. I know for a fact that at least three-quarters of doctors are fat phobic, and I think it's actually probably much more than that. I think that's a very kind of generous number. But that's 3 out of 4 doctors have already
yeah.
failed us, and it's more than that. So you've got your GP, your private GP, this woman who is an absolute legend and whom has really helped bring you back from the brink of something really quite awful. And it shouldn't take that.
Yeah.
It shouldn't take somebody caring enough to give their time and energy, because it's not possible to do that for everyone. And so
No, exactly.
this is not the solution. And as
No.
happy as I am, and I want to hear the story now about what happened when you went to your GP recently. We need to hear the story because we've been waiting. It's been a long time. They've teased this. Make it good, Ross. We've teased it out. Make it good.
Um,
Feel free to
yeah,
embellish.
just to pick up on what you just finished saying there,
Yeah.
also processing the sort of guilt that goes along with how lucky I am to have met her when that's not available to everyone and it's not a solution to the systemic problem, as you rightly point out. Um, I'm at a point now where I sit more in gratitude than guilt around that. Um, but it's a trick as a person who comes from the socioeconomic background that I have. It's a tricky thing to get my head around, and the fact that even private medical practitioners exist blows my mind, my little
Mm.
working class Nordy mind. Oh. But I am eternally grateful for that. That's a weird place to sit. I'm not complaining about it.
Yes.
Absolutely not a complaint at all. Just an acknowledgement that it's a complex place to sort of sit.
And I want to acknowledge that as well. And I don't want to diminish anything you just said. And I just want to add that really, genuinely, truly, you're one of the best people I know. So if I had the power to distribute a private GP to anyone, I would have put you right at the top of my list.
That's very
So,
sweet.
so I mean, not that that means anything or is
I
going to
know.
impact you in any way, but actually, you fucking deserved it. And I also think you are battling, or you are struggling with a lot of multiple marginalized identities. You're neurodivergent, you're disabled, you're queer, you're trans, you're fat. I've just counted
There's a
5.
lot going on there, yeah.
You come from a working class background, you don't have a pension. We put all of those things together, and actually, you absolutely are deserving. And what I really want is one of two things. For there to be enough good doctors out there
Mm.
to help all the people like yourselves. But ideally, prevention is better than cure, that there's no fucking medical trauma to start with, and
Yes.
then, but that's a kind of utopian dream. And I'd love to say that I'm going to live to witness that. And I hope that there will be some changes, and I hope that, we all will be able to make some impact. But
Mm.
imagining a world where there's no such thing as trauma it just seems a bit, a bit a bit too good to be true. So if anyone was going to get a GP who went, I'm going to help you, you absolutely fucking deserved it. So I hear the guilt, I do. And I also just want to speak to that guilt and saying, well, no, but you genuinely deserved it. And I know everybody who knows you is going to feel the same way. Carry on, tell us the story.
Okay, so I it was getting into autumn last year,
Mm-hmm.
2024, and I
Mm-hmm.
needed my COVID booster,
Mm-hmm.
and I didn't want to or have the money to pay for it because they cost an absolute fucking fortune, which is another thing, is a sin, how much they cost to get
Is
from
that not
Boots.
free for you? Should be free
It's
for you.
free. It's free if I get it from my GP.
Oh, okay. Mm-hmm.
But if I go to a pharmacist or something else, then
Yes,
I
I
have to
hear
pay
you.
for it. The rollout of pharmacists doing it here was very late, and like, you know, I've had COVID so many freaking times because I
Mm-hmm.
stand in front of people and sing for a living.
Mm-hmm.
Um, I was like, I need this sooner rather than later because I can't afford to get COVID again because, like, good Lord, the impact is gross. Anyway, so I pulled on my big girl pants and I contacted my GP surgery, and I got an appointment to get my uh COVID vaccine. This was after, I forget because the time was so fluid and murky and swirling and like miasmatic that I can't even recall the time, but say a year and a half of me not even getting repeat prescriptions from them, so they didn't know if I was alive or dead. I saw the nurse who gave me the thing, and she was like, "Oh, should we get you in for some?" She sort of clicked on the computer and she went, "Oh, should we get you in to check your numbers and things and get you in for a little diabetes checkup and that sort of thing?" I was all, "Yeah, if you want, okay, no problem, of course." And I felt quite chill about it. I was like, "Yeah, cool, grand, do whatever you want to do." Took some bloods, um, and I came back like the next week or something to see her, and she was like, "Oh, so my goodness, your numbers are great. Your A1C is 49 or 48 or something like that. It was whatever it was bang on what what they want people with type 2 diabetes for it to be. Um, what have you been doing? Uh have you been losing weight?" And I took more joy in this sentence than I have taken in anything in my life. In that moment, I was like, "No, no, I haven't lost a kilo. Um, I've just been seeing a private GP and she prescribed a very low dose of a GLP-1, and it's worked to bring my blood sugars down without me having to lose any weight. It's been great." And the panic that ensued,
Mm-hmm.
that poor woman who, look, the nurse is a part of the medical system. Yes, I absolutely get that. Um, but she's sort of on the front lines out there trying to navigate a whole load of shit from doctors
Yeah.
and things as well. Do you know what I mean? So
Yeah.
I hold much more compassion for nurses in the world. Um,
Mm-hmm. Ditto.
but she, bless her, absolutely shit herself. Like there's no two ways about it. The panic that ensued. She was like, "Oh goodness, well, yeah, right." So she put me. The doctor came in. That was like it was like panic stations. This doctor came in and was like, "Well, you see, you really should have told us this because we have a duty of care for you." And I went, I literally laughed in his face. I literally went, That it was that laugh. It was my people call it my Ursula, the sea witch laugh. I literally was like, I can't believe you just said that to me. And I was like, no harm. I haven't heard from you. You haven't heard from me in about a year and a half. So yeah, where was that duty of care? And he was like, right, well, you'll get a phone call from us uh, on Monday. And I was like, oh, okay, cool. Have a lovely weekend. Bye. And I just sat there being the smuggest mucker that had ever lived. I sat there grinning. I was beaming. I was just everything that they said to me, even when they were being kind of a bit mean and a bit horrible and a bit dismissive. I sort of turned into the Queen Mother. By that I mean, you know the way the royals have of when someone's rude to them, they treat it as like, oh, you've you appear to have accidentally called me a dickhead. What a funny little oversight that you've just made. Do you know what I mean? Like I just went into that mode
Mhm.
and waltzed out of there in giving my best life. And then, do you know it was great crack, but then we'll hear the pettiness. Now, lean in. With the pettiness of this doctor's surgery,
Mhm.
I have to admire. I didn't ask them to prescribe me the GLP-1. I said nothing about it. I just sat there and literally went, yep, no, no, wait, yeah, no, just GLP-1. Yes, through a private practitioner. Yes, yeah, she's a GP. Mm-hmm. Yep, she's registered. Yes, she's a GP. And I got a phone call from their pharmacist the Monday morning saying, "Hi, so you're on a GLP-1 and you're looking for us to prescribe it." And I was like, "That's not how the conversation went, but okay, yeah, whatever." And she went, we're not going to prescribe that for you. You would need to have that you need to have that prescribed by an endocrinologist." And I was like, "Right. Is that your protocol? Because that's not what the guidelines say. The guidelines are very clear." Thankfully, one of my best mates is a medic, so she had sent me the prescribing guidelines and around it, and I had them in front of me. Oh, I was ready. So then I went to see the GP and had the same conversation. He was like, "So do you understand why we can't prescribe it?" And I went, "No, no, I don't. Can you explain it to me again? Because what you said isn't what's in the guidelines. So is this a practice-wide protocol, or where is this coming from? Because I don't understand. So can you explain it to me again, please?" With my
Mm.
little wicked little
Mm.
smile and my bold
Mm.
orange lip I was wearing that day. I remember the
Oh,
color,
nice.
sort of tomatoey orange.
Nice. Hmm.
And the guy like started sweating because there was this small because I just put this small pushback of going like, no, I don't understand why you can't prescribe it.
Hmm.
Um, and he literally couldn't explain. So I was like, okay, so are you going to refer me to an endocrinologist so that they can prescribe it, or we or what's happening? And he was like, well, I don't know. And I was so full of like my own joy at that point that I was like, what do you mean you don't know? Like I was literally just like I was actually being really chirpy and friendly, but so combative,
Hmm. Nice.
which is an energy I hadn't had in quite some time. And I thoroughly enjoyed it.
Yeah.
Um, because then um he did he was like, well, it's probably going to be 4 or 5, 6 months. And I was like, well, that's fine, better referred than not.
Hmm.
So he did the referral. I actually got an appointment with the endocrinologist in 6 weeks, 7 weeks. And she sent me her clinic notes that she took that were basically like, yep, Ross is doing really well without weight loss being a goal of theirs. So can you prescribe him the GLP-1, please? Thank you. My mate was like, I would love to have been a fly on the wall whenever they got that clinic report.
Mm.
They are going to be raging. I was like, do you think they're going to be raging? She was like, oh, they are going to be raging, Rossi. So now they have to prescribe to me every single month. It comes out of their fucking budget or whatever the hell it is.
Mhm.
I don't have to pay for it anymore. And my blood sugars are getting the benefit of it without me having to invest in it financially. And they're responsible for it. They have to check my bloods. It's wonderful.
Well
A
done.
bitterness and spite that is fueling any type of physical health I have right now.
That's good though. I mean, it's clearly working. I mean, you're living proof. Um, I love that. I love that for you. I love that for them. I just sometimes they
Mm,
need to be brought back down a peg or two, and this is definitely going to run, and they are going to be furious.
yeah.
And I am really happy about that. And it's interesting because I think I've said to you, it's so strange because up here in Scotland, I mean, they've got they will prescribe, but the nurse will prescribe a GLP-1. Don't need a doctor to prescribe one, and the nurse will do it. So it's odd to me that they don't. Um, and
I have
also,
a feeling that had I said I would like you to prescribe me this to lose weight, that
mm,
they probably would have done.
mm, yeah, it's certainly prescribed with a view to weight loss.
Mm,
And I just wanted to take just a moment for a bit of a teaching moment here that GLP-1s are not awful. They were designed to treat diabetes, and for some people they were, and for some people they don't.
yeah.
And For some people they will dramatically reduce your blood sugar with a very low dose.
Hmm.
In order to get the real sort of weight loss side effect that you're looking for, you need quite a high dose. Of course, you can't just get one side effect in isolation. When you get one side effect, you get all the side effects. So that's why when we're treating diabetes, we go for the lowest possible dose. And it sounds to me like you're on a low dose, which is managing your blood
Hmm.
sugars beautifully. And
Yep.
when we have that, these drugs are actually great. They're doing exactly what they were designed to do.
Yep.
Um, it's when we start bringing weight loss into the equation that we actually make life harder because we're now putting people at risks because in order to achieve that weight loss, we're giving them all the other side effects that they actually don't need or want. So what a
Mhm.
lovely what a lovely outcome. I'm really genuinely happy for you and genuinely happy that that's the way that it worked out. That being said, I wish none of this had happened to you. I
Mm.
wish that a doctor had taken your long COVID symptoms seriously, or has already. I wish that your doctor had just treated your diabetes as per protocol and not mentioned weight loss because weight loss is absolutely fucking useless when it comes to diabetes. I wish that your doctor was treating your ADHD, that you hadn't had to go to a fucking cardiologist to manage blood pressure. Quite frankly, how useless do you have to be to refer a person to a cardiologist to manage blood pressure? Um, I wish that when a doctor was nice to you, you didn't like cry so much that tears were dripping from your beard. I wish that um, you hadn't had to cut off your feelings and your trauma and sort of had to sort of put it to one side in order to function and to get back into society and to be able to do the things that you wanted to do. I wish that you didn't have to go through any of it, didn't have to have all of that trauma and all of those horrible experiences. And also really looking forward to the play because I think it would make for an amazing play. And I think it's what we need. And I think you are the kind of person that processes these things creatively, and other people benefit massively. So, you kind of did announce to the world you were going to do it,
Mm.
if you
Yeah, I
know
have to
that.
put my finger out now, don't I?
Well, I'm
Oh
not.
no, I have to go and sit beside a lake and write a play. Oh, poor me.
I know. I know. No pressure, but you kind of said it out loud, and there's going to be no expectation. And
Yeah.
you
No,
might
fair,
phone
that's
me.
fair.
You might
Yeah,
phone me occasionally, going, "How's it going? What's happening?" Um,
yeah.
to the people listening, talking about medical trauma is becoming increasingly more important to me. As much as I love doing all of the work where I am trying to teach and educating people around me that weight loss is completely fucking useless and has serves no purpose other than to make people miserable and make other people rich. Um, I am beginning to realize that there is the real need to talk about these kinds of trauma and find ways to process them. So stick with me, stick with Ross. Thank you so much. Anything you wanted to add before the end? I mean, I feel like I've just cut you off.
No, I don't think there's anything I want to add. But just as you were saying, the creative process, your creative process, as in the way you use the skills that you learned in the Empire, now against the Empire,
I'm a rebel.
and the way you synthesize information for people is also hugely, hugely, hugely important. And you're part of a community and a movement in a world that of which there are many different opinions and people disagree and people could, you know what I mean? Like it's not one
Mm.
unified thing either, of course, but you, you're such an important voice in that, and the work that you do was such an important part of my cognitive processing of that shame to get to even where I am now. So thank you for being you and for your work.
Fuck you is all I can say to that. How dare you embarrass me like don't look this way. If you watch it on YouTube, you can see the face. How dare you? Now, people need to start following you on Instagram and TikTok because
Oh
just
yeah.
quickly tell us about the Who's. Come on. Go on
Okay,
then.
so I started a TikTok because I realized, well, I don't have a pension. I might have mentioned that. And there are people who just sit on their sofas and talk shite and make a little bit of money off TikTok. And I was like, I can do that. So I
Hmm.
started doing that
Hmm.
essentially. I made a comment where I made a little small video about a type of person on TikTok who is claiming that they have been a people pleaser their whole lives and is, um, simply not going to people please anymore. And my question was, whom have you pleased, Sheila?
Was it
Because
Sheila or Debbie? I couldn't remember. It was
it was
Sheila.
Sheila.
Okay. Yeah.
I was like, Sheila, whom have you pleased? Because I've known you for 20 years and you've never pleased me once. You're singularly one of the most awful people I've ever met in my life. You're not a people pleaser. You're a hateful person and you're weaponizing therapy talk. Get out of my face. Just accept the fact that you're a hateful whore and move on.
Hmm.
I said, because I said the word whore, then people started commenting and really enjoying the fact that I'd said the word whore. So then I kind of started a whore's assembly.
Mm.
I, someone put it in the comments, not a whore house, a whore home. And
Oh, nice. The Who's.
so
There's
I
three
made a
Who's.
little, I ended up on German TikTok, Swiss TikTok, Danish TikTok, because the word whore is obviously the same there. Um, but as I said to them, it's in Hiberno English and Scottish English and Scots, it's it's an expression, yes, of someone who is a sex worker, and that's an amazing thing to be celebrated too, and we absolutely must do that. The
Yeah, yeah,
actual Who's are the most
yeah.
welcome, of
Right.
course.
They're the kind of top tier Who's.
Top tier Who's. The rest of
Mm-hmm.
us, we're dead on, but like
Yeah.
we're not. The actual Who's are the ones
No.
that we need to be throwing
Hmm.
our full support behind too.
Hmm.
But
Hmm.
like all types of hers are
Hmm.
welcome. And it's not necessarily your dedication to sex, however that is for you. It's more
Hmm.
about your a dedication to a boldness and a bodiness
Hmm.
and a lack of even acknowledgement of convention that I
Hmm.
love about the hers. Do you know what I mean? And
Yes.
that can be in a very quiet way. It doesn't
Hmm.
need to be in a loud, brash way like mine is. It can be in a very small, quiet, contained, shy, socially awkward way.
Hmm.
You know what I mean?
The
But it's an
autistic
acknowledge.
Who's, if you will.
Yes, the autistic hers, the hers
Yes.
with autism. We love them. Love them. They're the best one. Do you know what I mean? Like it's great.
Yeah.
And it's just and it's acknowledgement of people, like yeah, people who see metallics and leopard print as neutrals and are very happy with that.
Hmm.
You know what I mean? And
Yeah.
those who will look at other people who see metallics and leopard print as neutral and go, yeah, you're cool. Not,
Hmm.
I can't believe you're dressing like that. Do you know what I mean?
Hmm.
It's the hers. So anyway, the TikTok has started to go quite well, and some people have seen the things, and it's very enjoyable. And it's at cabaret underscore Ross. Because I'm a cabaret artist. I started out thinking, I'll make it about my life as a cabaret artist, and it ended up just me talking.
I think that I think there could be flavors of the cabaret because I think that's, I think we love to see it, but I just think that it's enough. There's one particular video that came up on my feed that was basically like, if this is ended up on your FYP, if it's on your for you page, that's a sign that you're a hooer. It's like that is exactly what it is.
That's a sign.
Congratulations.
Welcome.
The,
Come on in.
the,
The
the
water is fine.
algorithm, the algorithm finally got it right. I was like, yes.
Mhm.
So follow, please. Follow Ross on TikTok if you're on TikTok and on Instagram. I don't know
Yeah,
whether
sure.
that's helpful as well, but yes.
Yeah, do it.
All the links will be in the
All
show
welcome. The
notes.
fat hers are welcome. The trans hers are welcome. The disabled hers, your divergent hers, all the hers.
All of them all
All
together
welcome.
in one place. That's what we need.
That is
Yeah,
what
but
we
you really do entertain us, and I am very grateful for that because sometimes we just need a bit of lighthearted, and it is always
need.
lighthearted, but also with a message. Because as you say, the weaponization of therapy talk is really problematic on TikTok. So I'm glad we
Gross.
talked about Sheila. Glad we did.
Thank you so much.
Thank you so much for being here. It's been a pleasure talking to you again. And I will obviously ask you again and again and again to come back. But we'll keep an eye out on how goes the play. Yeah.
Okay.
Yeah, no
Okay, I'm locked
pressure.
in now, lads.
You're
Locked in.
locked in.
Hey. Thank
Thank you so much for joining us. And
you
folks,
so
thanks for
much.
listening. We'll see you next week.